So in the morning you should be switching the power on the switch, which opens up everything in the surgery, and then you start by wiping the low risk areas. So the low risk areas are classed as the worktops, any ledges, if there's any dust anywhere in the surgery. You should be doing a spot check. If there's any dust on the sides, you should be cleaning that as well. Any used wipes go into the clinical waste bin. So again, we're doing all the low risk areas first, so areas that are not contaminated and what have been sat overnight or over the weekend. Once you've finished your low risk areas, we will start with the chair. The chair also needs wiping down first thing in the morning. Just to remove any dust or anything that's been stuck on it in the evening. Just to note, you should be wiping the same way after every single patient as well, once the clinic starts. The base of the chair gets wiped down as this area gets really dusty. Okay, once you're happy that everything's been wiped down and everything's clean and ready to start for the day, you then lower the chair on the foot pedal. So the foot pedal has arrows, up, down, right or left. You should be set at a default. The dentist normally does this, but if you just press down, it should work its way down on its own. And this is the foot pedal for the hand pieces as well. Okay, so every evening, you should be flushing your lines through, and every morning. So this is a setup, so what we're doing is flushing the lines through to make sure there's no Legionnaires gathering or any bacteria in the pipes. So we're just flushing for 3 minutes. I'm not going to do 3 minutes because we'll just be here forever. So there's the hand piece, then we use the foot pedal to flush the hand piece through. And the last thing what uses water is the scaly unit. So we'll flush that again for 3 minutes. Just to note, these all should be flushed after every patient. If you've used anything with water, it needs to be flushed for 30 seconds. So that's that done. As you can see, there's a water, we have filled this up this morning, so there's a water bottle which has got distilled water in, so that is emptied every night. You take the bottle off and then we replenish and replace the bottle with distilled water up to this level in the morning. So we've had the filter, which has been soaked in bleaching water overnight, so we'll just empty that and then replace it. So each night this gets taken out, and I'll show you this in the setup video. Once the filter is in, and then we can just flush some warm water. We've used Alpen in here on the evening, so you put Alpen and warm water to flush everything through, all the blood and saliva. So every morning, we just ensure that the tubing's clear and free from any debris or any solution or any chemicals, so we just suck up all that with the warm water. Okay, so that's it. The surgery is set up, the chair is ready to go, so your next thing to do in the morning would be you'd remove all of your PPE into the clinical waste bin. You would do a clinical hand wash, which I've shown and demonstrated on previous videos, and then you'd set up your computer for the day. You then need to check your day list and to check everything's correct. All of your patients are booked in and the medical histories are ready. So if you've got paper notes, it's a good idea to get them out on the side as well, and have a printed day list. If there's a fire, you can take your printed day list, and that's used for fire hazard.